What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa and you are watching Canadian Physio Student. The OSCE.
No, God! No, God, please, no! No!
The objective, structured, clinical examination. The one test that makes all physio students far and wide literally shake in their boots. The information overload, the unknown, and the pressure to perform competently within a strict and unrealistic time frame can definitely weigh on you, especially if you're a first-time goer. And on top of all that, it does not help hearing all the hype around it from the faculty members and past students to make you feel even more nervous than you already are. But with all that said, I'm here to tell you today that it is not that bad, and this isn't something that you should be feared of. Yes, it is very stressful and there's no way around that, but I feel like if you take the necessary steps to prepare yourself for the big day, not only will you pass, but it'll also be a great learning experience for you in the end. But then the question becomes, how do I prepare myself for this OSCE? Well, I hope to answer that in this video by giving you guys my best tips and best pointers on how to prep yourself before the OSCE, as well as some tips on what you should do during situations that may arise during your OSCE. And then lastly, hit you guys with some pointers on what you should do post-OSCE. But just a quick disclaimer before I start saying all my tips, everything I say here, just take it with a grain of salt. As I mentioned in all my other tip videos, these are all the things that have worked for me in the past, but they may not exactly work for you as everybody's different. So in my overall message, just choose some of the things that you think would work for you and then go from there. So now that you know all that, let's not waste any time and get right into it. And let's talk about what you should do pre-OSCE to prepare yourself the best for the test. So my first tip here is just pick one or a few people to practice with as you're practicing for the OSCE. You know, it is tough to bounce from person to person if you're practicing with too many people, but if you have one or a few, you really start to get in the groove with them, you really start to understand each other, and because you're practicing with each other so often, you can see what your partners have to improve on better than anybody else because you're practicing with them all the time. And my second tip here is be critical of each other. Be critical of the people that you're practicing with and expect the same from them. You know, set it straight from the beginning. This isn't about feelings, this isn't about taking it personally, it's about improving your partner while also trying to improve yourself. And after every practice round of a certain skill or a certain scenario, just debrief and say what people did well and what people didn't do well. My third tip here is if you're acting as the patient and your partner's acting as the therapist practicing on you, don't see that as a break. Just because you're not the one actually doing the clinical skills on the patient doesn't mean that you can't use that as a learning experience and see kind of what your partner's doing right and what they're doing wrong, and then take that with you so that next time you do that clinical skill, you don't have to make those exact same mistakes. My fourth tip here for you guys is before you start practicing scenarios like the ones that you'd see on the OSCE, first, just make a list of the general clinical skills that you need to know and make sure you guys are compartmentalizing them. So an example of that would be if you're working on the knee, make sure you just make a list of all the special tests on the knee, practice those with your partner, make sure you both go through them, get those down pat first, and then you can get into the scenarios. With that said, that's a good transition to my next tip for you guys, which is make scenarios for yourself. Make sure your partner makes some for you, and then make sure you make some for your partner. And please do not half-ass them. Make them as if they're gonna be the scenarios that you're gonna see on the OSCE. If you guys want some examples, you can go into the description below. I left a link there, which will direct you to a page that shows you guys some of the OSCE scenarios that I made for myself when I was practicing through it last year. But just going back to making scenarios for yourself, just know that if you can make good scenarios for yourself that actually simulate what an OSCE would be like, that means that you've made your transition between the know what, know how, and now you're at the know why stage, because you're taking all that information that you've learned in class and you're starting to apply it within a real life situation, and you can kind of see the connection between things. So don't see it as a time away from not actually practicing. When you're making these scenarios, you're learning a lot, and it's actually going to help you for when you eventually start to practice again. My next tip for you guys, and this one probably goes without saying, but you need to practice these scenarios and simulate them as if they're the real OSCE. So, get your timer ready, set up a hand wash station, make sure that there's an initial barrier between you and the patient. So make sure that there's a door there, or just an imaginary door there. But yeah, just get yourself in game time mode. Make sure you're acting as if it's the real thing. Knock on the door, walk in, do your intro, get consent, wash your hands. And then if you're the patient, the one who's acting, make sure that you're actually acting as if you're a patient who has no idea what to expect and no idea what to do. So that makes it challenging for the therapist, because it makes them have to actually adequately explain everything that they're going to do, and then that will simulate it as if it's the real OSCE. My next tip for you guys, which is something that really helped my roommate and I prepare for the OSCE, was setting up checkpoints within your actual living environment. So what do I mean by that? Well, I'll give you a few examples. So what my roommate and I did was, for our therapeutic modalities course, so the course that you learn about ultrasound, the course that you learn about TENS, IFC, NMES, all those therapeutic modalities, as you guys know as physio students, all of those modalities come with their own set of contraindications and precautions. And some of them are very similar, but some of them have differences between them, and you really got to get those down, because when you get into the scenarios, you have to clear all of those precautions and contraindications. So what we did is we made a list of contraindications and precautions for each of those therapeutic modalities, and then set them up as checkpoints within our house. So for example, the ultrasound contraindications and precautions, we put that one right in front of our microwave. So if there was a time throughout our day where we wanted to use the microwave, we had to first list all the contraindications and precautions before we could use that microwave. So if you want to heat something up, you got to be able to list them off first, or else you're not going to be using the microwave. So this really forces you to just know them off by heart, know them right away, because when you get into those scenarios, you just got to bang them off quickly, and that's really going to get you into the mode of doing that. My next tip for you guys is make a list of all those physio terms that you think you may use during your OSCE scenario. And then for each of those terms, match them up with a layman's terms or layman's phrase, so that when you get into the scenario, you can use the layman's terms instead. So an example I can give you guys is, if you're going into a scenario and you have to measure someone's shoulder abduction range of motion, don't say to the patient, yeah, can you just put your arm into abduction for me, please? Just demonstrate it to them and say, can you just swing your arm out to the side for me and make it go as high as you can go? And I know what you guys are thinking right now. You're probably like, Anthony, obviously I'm not going to say those things. That's ridiculous. But I promise you, you will surprise yourself, because when you're practicing with people who actually know what those terms mean, and you automatically default to using those terms. So you really got to get yourself in a good habit of saying all the layman's terms for all the physio terms that you may have to use during an actual OSCE situation and a patient encounter. My second last tip for you guys here is take breaks. Don't just be ripping a bunch of scenarios for 3-4 hours straight. I would say that optimal amount of time practicing straight would be about 1.5 hours to 2 hours. And then from there, take your breaks, because if you're just going straight 3-4 hours, you're gonna lead to, mental fatigue. You guys are gonna start becoming complacent. You're not gonna be picking on things that your partner may have did right or what they did wrong. So with that said, just make sure that you're taking those reasonable breaks in between your practice sessions. And my last pre-OSCE tip for you guys is not exactly a tip, but kind of just addressing a question that you guys may be asking yourself a couple days or a day before the OSCE. And that question is, how do I know when I'm ready for that OSCE? And from my experience, it got to the point with my partner where we actually just started getting bored of running through those scenarios over and over again. And we kind of just came to the realization that we just wanted to get this thing going and actually do the test. And that's when we realized we're probably ready for this, and we can just take a bit of time, decompress and just spend time with ourselves before the actual big OSCE. So now that you guys have all those pre-OSCE tips, I now have to give you guys my tips on how to handle some situations that may arise during your OSCE, and just some general tips on how you can kind of relax yourself while you're actually in the situation. So my first tip for you guys, which is probably my biggest tip in this whole video, and it seems very simple, but it's definitely something that's worked for me and definitely something that has helped calm me down during my OSCE scenarios. And that is, when you're reading that scenario, first thing you got to do is take that person's name in the scenario, put it in the back of your head, and when you walk into that station, the first thing you say is that person's name.
Alan! Alan! Alan!
Like I said, I know this seems simple, but people usually don't do that. They just get right into their own introduction, and it's very robotic and really unnatural. And I found that when I started just saying the person's name first and just starting a regular conversation as if I would during my placement and just during any type of clinical setting, it really calmed me down and it really made everything run smoothly for the rest of the station. So I'll just give you guys an example of what my OSCE stations are like when I use this strategy. So when I'm outside, I'm reading that scenario, say the person's name is John, put that in the back of my head. When the bell goes off, I knock on the door, walk in the scenario, and I say, John, how's it going today? John will say, it's going well, how are you? I respond by saying, I'm doing well, John. Do you go by John, or do you have another preferred name? John will say, no, John's great. Awesome. Then from there, I'll say, just to introduce myself, my name is Anthony Pinto da Costa. I'm a second-year physiotherapy student here at Queen's University, and I see that you're having some shoulder problems today. John will say, yeah, I just haven't been able to move my shoulder as well. I feel like it's weak, and I decided to come into physio to try and figure this out. And then I'll say, John, I'm sorry to hear about your shoulder. I'm happy to help with it. I'm happy to address any concerns or any limitations that you may be feeling right now during our assessment, and then hopefully devise a treatment plan from there that will get you moving again pain-free. All right, I feel like I kind of went off on that one, but it just gets me fired up because it seems like it's something that's so simple, but it's something that has really helped relax me during all of my OSCE scenarios. Anyways, my next tip for you guys is operate on your own schedule. If you're reading that scenario outside of the room and you didn't finish it before the bell goes off, just enter the room, do your intro, and then just say to the patient, I just didn't finish reading your chart. I'm just gonna finish reading it, and then we'll be able to progress from there. Don't worry about all the other people next door starting their scenario as soon as they walk in, because what they're doing next door has no effect on what you're gonna do in your scenario. So just take your time. Everybody has the same time, and just operate on your own schedule. My next tip for you guys is, if you forget to do something earlier in the station, but then later in the station you reach this point where you're like, oh my God, I just forgot to do that one thing earlier in the station, just verbalize it. Just say it out loud that you would have done that if you were in a situation where you had to do it again. So an example I can give you guys is, say during a station you were instructed to take a goniometric measurement of somebody's elbow flexion and extension range of motion while they're in the supine position. And when you took your measurement earlier in the station, you didn't put a towel underneath their humerus to stabilize the joint. Just say out loud that if I were to take that measurement again, I would have put a towel there, because you may be able to get some of those part marks during that station from the person who's actually marking you. So just know that there's no harm in saying that out loud during your station, because it's showing to the person who's marking you that you're being introspective and you're kind of catching the mistakes that you made earlier in the station. And then from there, they should take that into account on what your overall grade will be for that station. My next tip here is probably more geared towards students who are doing their OSCE for the first time, and that is refer back to the patient's chart as many times as you need during that station. I remember as a first-time OSCE goer, some scenarios would just have a long list of things to do, and by the time I got into the scenario, I would do the first thing on that list, but then my nerves would take over, and then I'd be like, I don't even remember the other things to do on this list. So I would constantly have to refer back to the patient's chart, which is totally fine. My advice for doing this though is just be professional. Make sure you're saying to the patient, hey, can you just give me 2 seconds to check your chart, and then we'll continue with the assessment. As long as you do that, you should be fine. My next thing here is when you're explaining what you're gonna be doing with the patient, do not over explain what you have to do. This is a very easy trap to fall into because when you're learning about gaining consent, they make it seem like you have to say every single detail of what you're gonna be doing initially to the patient before you even put your hands on them. And yes, you do have to say every detail, but you don't have to say it right there, right away. Just give them the big picture of what's gonna happen, and then as you go through the assessment process, give them each detail and give them each step. So don't over explain. Remember, you have the time to consider too when you're in the scenario. And then my last tip for you guys during the OSCE is don't be so hard on yourself for those first couple stations. You know, your nerves are just gonna be firing at an alarming rate. You're not really gonna understand what's happening with your body. You feel like you're gonna explode and you feel like you're just gonna crack. But as you're experiencing that, just remember 2 things here. 1, the people who are marking you in those stations understand that your emotions and your nerves are just taking full control of you right now. And as they're marking you during those first couple stations, they're going to take that into account. And then number 2, realize that you still have a long way to go. Just because your first couple stations didn't go as well as you wanted to, it doesn't mean that you have more time to improve on them in the later stations. Plus, I guarantee after those first 2 stations, you're really gonna settle in, and those remaining stations are not gonna go as those first 2 stations went. And this is gonna sound weird, but after those first 2 stations, you pretty much just black out and you're just going through the motions of the OSCE. You're just doing what you gotta do and everything is just kind of automatic. And then you finish your last station and you're kind of just like, okay, we made it, I guess. I guess it's over because you just blacked out for those last, remaining stations there, which is definitely a weird feeling, but it definitely makes you feel a bit more comfortable for the rest of the OSCE. So that's all the tips I have for you to handle situations during your OSCE. Now I will tell you my tips on what you should do post-OSCE. And my first and number 1 tip for post-OSCE, again, probably goes without saying, but do not study, go out with your class and just completely decompress for what you guys just experienced. Honestly, spending time and going out with my class directly after the OSCE have been some of the best and most memorable experience that I've had so far with me throughout my course of physio school. So please just spend time with your classmates, go out with them, because that is honestly the number 1 thing you need after experiencing what you just experienced. And then my second and last post-OSCE tip for you guys is when you meet up with your class, you're gonna realize that people are gonna be talking about the OSCE. They're gonna be talking about some of the situations, some of the scenarios that were on when you guys were in the test. And people are gonna be talking about some specific scenarios. And then they're gonna be telling you what they did in the scenario. And then you're gonna start comparing it with what you did and what you didn't do. And then you'll start realizing to yourself, oh my God, I didn't do all these things. Like, did I fail the station? Did I not do well in the station? Don't worry about that, okay? Most likely the things that people are pointing out are very small details and things that are worth maybe 1 or 2 marks. And if you didn't do it, it's all good. As long as you did all the other general things in that scenario, then you're gonna be fine. People just point out the smallest details, so don't sweat the small things here and just be confident in what you did during your OSCE. So I just want to conclude this video by saying that I understand that this whole OSCE thing is a very daunting experience, because once you get in there, once the bell goes off, and once you're finally in the situation, it is all on you. I want you guys to try and positively frame these feelings, okay? So what you're experiencing is most likely rational anxiety as opposed to irrational anxiety. You're having all these fears, you're having all these worries because what you're doing right now is important to you. You want to make sure that you're really good at what you do in the future, and you want to make sure that you do well on this test, which is great. I would be more concerned if you didn't have all these worries and you didn't have all the stress, because maybe it's not that important to you. So just know, if you're feeling like this, completely normal, and it's probably a good thing. So try to use it to your advantage as best as you can. And most importantly, just have fun. I know you guys are probably looking at me as if I'm nuts for saying that right now, but I promise you, once you settle in and once you start getting everything going during that OSCE, it honestly is a fun experience. So I hope you guys experience that too. So I've said a lot here, and I hope all my tips and all my pointers that have worked for me also work for you guys too. Again, take what you want from my message and apply it to your own situation. So guys, if you like this video, make sure to like, share, of course, smash that subscribe button. And if you have any comments or questions, feel free to leave them in the comment section down below. If you don't want to do that, you can DM me on my Instagram at CDN Physio Student, and then we can have a conversation from there. So again, I hope you guys enjoy this, and I hope this helps you out, and I will see you guys at the next video.
Another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.